Welcome back. This is Arabella Hayter again. Following the journey through the WASH Fit improvement process in the previous modules, we will now move on to a series of technical modules designed to deepen your expertise and practical skills in specific areas critical to healthcare facility management and quality improvement. These modules cover water, sanitation, hand hygiene, environmental cleaning, waste management, and gender equality, disability and social inclusion, otherwise known as GEDSI. Climate considerations have been integrated throughout these modules. In this module, we will learn about requirements for safe water, which is crucial for the safe functioning of a healthcare facility. We will look at the effects of an inadequate water supply and describe minimum requirements for a water supply, including quality and quantity. We will look at how to apply a risk-based approach to managing water quality and briefly touch on water safety planning. We will also look at plumbing issues and solutions for a better functioning facility and explore the impact of climate change on water supply and some adaptive measures. Let's begin. Insufficient drinking water poses health risks such as dehydration and limits patients' ability to take medications. Contaminated water can lead to diarrhea and waterborne disease outbreaks like cholera. Insufficient water for hand hygiene leads to the spread of infections, making it difficult to contain outbreaks and risking patient and staff safety. Water is also needed for cleaning, showers, and toilets, without which there is a risk of spread of fecal contamination and antimicrobial resistant infections. Beyond the risk of infection, insufficient water also leads to an unsanitary environment, which may be visibly dirty, decreasing care seeking and staff satisfaction and motivation. Water should be a top priority within all quality improvement, infection prevention and control, and of course, WASH Fit efforts. Since 1956, WHO's drinking water quality guidelines have been crucial in tackling health risks from unsafe water, providing a risk-based approach to address microbiological and chemical hazards. In lower income areas, the focus is on combating microbiological contaminants, such as fecal matter, which compose significant health risks. These guidelines are supported by additional resources like climate-resilient water safety plans and regulatory frameworks. You will find links to them in the resources section. Water safety planning, through preventative measures, maintenance, and monitoring, ensures water safety in healthcare settings. It is the most effective means of consistently ensuring the safety of a drinking water supply, and it is the methodology on which WASH Fit is based. We will now look at water safety planning in more detail. A water safety plan, or WSP, is a comprehensive risk assessment and risk management approach that includes all steps in the water supply, from catchment to consumer. WASH Fit incorporates parts of the WSP methodology, such as sanitary inspection forms. However, WASH Fit does not cover aspects like surveillance or regulatory compliance. Countries and communities already implementing WSPs are encouraged to expand these efforts to healthcare facilities. This means, in practice, that the water domain within the WASH Fit assessment will incorporate more detailed indicators for additional elements of water safety planning. These could include describing the entire water supply system, monitoring control measures through operational monitoring plans, monitoring water quality for compliance with regulatory requirements, and engaging with the appropriate authorities on water quality surveillance. Facilities seeking to enhance water safety can consult local WSP experts for support. For further information and resources on WSPs, please look at the WHO website and this course's resource section. There is also an open WH course on WSPs you may wish to take. Now let's take a look at some other requirements for a facility's water supply. Water requirements in healthcare settings vary based on the level of care provided. Regardless of the type of facility, Water should meet WHO minimum standards on quantity and quality. For secondary and tertiary facilities, water may need to meet even higher standards, especially if there are intensive care units or highly infectious disease services provided. Minimum requirements state that water must be on-site, from an improved source, and available at all points of care. It must be safely treated and reliable, and of sufficient quantity to meet the facility's needs for 2 days. This covers a range of purposes such as drinking, bathing, and environmental cleaning. How do you calculate how much water a facility needs? The WHO 2008 Essential Environmental Health Standards in Healthcare outline minimum water quantities and can help facilities to assess their unique water needs. These guidelines cover the quantities required for drinking, cleaning, hand hygiene, and waste management. Specific medical applications like dialysis are not included. Factors influencing water needs include a facility's operational days, patient turnover, the services offered, and fluctuations in demand affected by seasonal patterns, climate change, disease outbreaks, or births. For example, an outpatient only requires 5 litres per consultation, while treating an Ebola patient requires up to 400 litres of water per day, and a woman delivering will require 100 litres. Remember, at least 48 hours worth of water storage is recommended, and facilities may need more storage during periods of scarcity, like in the dry season. Improved water sources are those which are designed or modified to protect against environmental contamination, particularly from fecal matter. These include piped water systems, boreholes, protected dug wells, springs, and collected rainwater. Treated water delivered through bottles or tanker trucks is also considered improved. In contrast, unimproved sources lack the protection from contamination, and these include open dug wells, springs, and surface water like lakes or rivers. Regardless of the source, however, water should be treated to ensure it is safe. 3 types of microbes are commonly associated with waterborne diseases. Viruses like hepatitis A and poliovirus are the smallest, ranging from 0.02 to 0.3 micrometers, while bacteria such as E. coli and Vibrio cholerae span 0.5 to 2 micrometers. These can contribute significantly to diarrheal diseases. Viruses like SARS-CoV-2 and Ebola, primarily transmitted through non-fecal oral routes, pose minimal waterborne risk. Protozoan cysts like Giardia and Cryptosporidium are larger, exceeding 2 micrometers. Legionella is also becoming increasingly common in healthcare settings and requires special attention. Legionella is a naturally occurring bacterium in freshwater sources like rivers and lakes. In these environments, Legionella typically exists in harmless amounts, posing little threat to human health. However, under certain conditions, Legionella can multiply to dangerous levels, causing Legionnaire's disease, a serious form of pneumonia. This disease is contracted by inhaling small droplets of water contaminated with the bacteria, often through mist or vapor. The incidence of Legionnaire's disease is on the rise, most likely due to aging water systems, climate change, and better surveillance. For healthcare facilities, it is important that a water risk management plan is developed as part of WASH Fit. This involves describing the building water system and identifying areas where Legionella could grow and spread. These could be fountains, cooling towers, or showers. There are several basic preventative measures you can take, including maintaining water temperatures above 50 degrees centigrade or below 20 degrees, preventing stagnation by fixing dead ends, ensuring appropriate disinfection concentrations, including after adverse events, and providing proper plumbing to prevent a habitat suitable for Legionella. You may need to consult skilled plumbers and water systems experts for support. WHO and the US Centers for Disease Control Both have guidance on mitigating the risk of waterborne diseases and Legionnaire's disease. Safe drinking water is indispensable in healthcare facilities, protecting the health of staff, patients, and caregivers. According to WHO guidelines, safe water should pose no significant health risks across all life stages. There should be no fecal contamination, indicated by a lack of fecal coliforms or E. coli. Alternatively, there should be a free chlorine residual of at least 0.2 milligrams per litre, and the water should not be turbid. Water should be safely stored, which means clean containers with covers and taps. They should be regularly cleaned and disinfected. Water should be accessible to all users, which will require pathways to drinking water and hand washing stations to be wide, flat, and obstacle-free, and clearly signed. Taps should be an appropriate height, and if cups are provided, they must be kept clean. During emergencies, you will need to fill drinking water stations and treat the water more frequently to meet increased patient load, procure more water, and arrange in-line treatment for piped water. There are 4 suggested ways of assessing and managing water quality risks. These are use of sanitary inspections to address risks at the source, reviewing regulatory data to understand water quality over time, regularly checking and measuring levels of residual chlorine, noting that this is a very cost-effective option, and finally, conducting fecal indicator testing, which verifies the effectiveness of water control measures and regulatory compliance. Portable water quality test kits typically include these tests. Strict adherence to sampling protocols, testing procedures, and data analysis will make results more reliable, help guide risk assessments, and determine the most appropriate interventions. Whichever way water quality is assessed, addressing hazards promptly is crucial. We will look at the first of these options now, sanitary inspection forms. These are an on-site evaluation of all conditions, components, and practices in the water supply system that pose an actual or potential risk to public health. WashFit includes a set of 4 SI forms, specially adapted for use in healthcare settings, which help pinpoint sources of contamination and guide you through ways to mitigate these risks. The 4 forms are for tube wells, boreholes, piped distribution networks, and rainwater harvesting. The forms contain a set of yes/no questions to identify the presence or absence of risk and produce an SI score to quantify overall risk levels. Using these results, facilities should start by focusing on critical risks, implementing low or no-cost measures to enhance water safety and supply reliability. These measures should be included in the improvement plan, developed in Step 4 of the WashFit cycle. Effective treatment methods must safeguard against all pathogen classes and be able to cope with changing water quality due to climate change or other factors. To help you select which water treatment technology to use, WHO evaluates various technologies under the Household Water Treatment Scheme. This international initiative assesses the microbial performance of on-site water treatment technologies against WHO health-based criteria. Based on WHO testing, higher performing technologies include high-quality membrane filters, UV disinfectants and flocculant disinfectants, effective chlorination, and solar disinfection. You will need to understand existing water quality and review manufacturer test data to make an informed decision about which technology to use. Where a technology provides limited protection, you will need to adjust chlorine dosing or employ additional technologies for multi-barrier protection. Most importantly, choose wisely. 8 out of 50 technologies tested did not meet WHO performance criteria. More details can be found in the reference page provided with this module. We will now look at plumbing practices, consider common issues and some cost-effective measures to improve the safety of water supplies. Take a look at this photo. What problems can you see? The most obvious problem is a corroded pipe, which has been poorly fixed with plastic parts. Faulty or leaking pipes and taps waste water and can increase costs to the facility as a result of higher utility payments and energy costs. Corroded pipes lead to poor water quality, chemical contamination, or stagnation due to dead legs. Blocked sinks and toilets can spread pathogens which pose an infection risk. Water pooling on floors and inadequate drainage systems create stagnant water, which provide easy access for mosquitoes to breed and further disease transmission. Gutters and drainage areas must be cleaned to stop vectors from breeding. Toilet side spray valves, which are popular in many cultures, are also a potential source of cross-contamination due to backflow. They require regular cleaning and checking to ensure they are operating properly. Healthcare facilities can implement simple, low-cost plumbing measures to address some of these problems. Here are a few examples. Regularly inspect and promptly repair any leaks in piping connections. Upgrade corroded or lead pipes to PVC ones. Position drinking water pipes above wastewater to prevent cross-contamination between safe water and wastewater systems. Install backflow protectors on bathroom fixtures to prevent the reverse flow of contaminated water. As previously discussed, regular water quality inspections, including visual indicators and testing for chlorine residual, turbidity, and fecal indicator bacteria are essential. Implement on-site water treatment if standards are not met. Clean and disinfect water storage tanks regularly, and all sinks and taps must be kept functional to prevent disruptions in water supply and access. For rainwater collection, cleaning gutters and roofs monthly and utilizing first flush devices and filters can help remove contaminants. If water quality is compromised, for example by flooding or other source of contamination, flushing the system and implementing appropriate water treatment methods can restore water quality. Skilled, trained plumbers with access to high-quality plumbing materials locally are needed for installation and maintenance. You may wish to consult local plumbing codes and standards, along with guidance and resources from the World Plumbing Council. Coming to our last slide, we will look at how we can strengthen the climate resiliency of water supplies. As the climate changes, many countries and their healthcare facilities face greater periods of water instability. Adaptations are needed to promote efficient use of resources, reduce chemical contaminants and pollution from carbon emissions, and in doing so, help cut overall costs. The first step should be to increase water storage capacity and install backup water supplies, which will be needed in the event of drought, flooding, fires, strong winds, and power outages. One example is rainwater catchment systems, which can be used where the climate, rainfall patterns, and available catchment and roof space allow. First flush devices and filter boxes will also improve water quality. Raising water storage tanks can reduce risks of contamination during floods and chances of structural damage. Raising tanks also allows for water to flow by gravity through a piped system, thus conserving and reducing energy costs. Remember, these systems will all need regular cleaning and maintenance. Backup water supplies should be treated, and additional treatment supplies should be stocked. Reducing water use by repairing leaks, turning off taps during hand washing, using high-efficiency taps and low-flow toilets will also help. During and after extreme weather events, prioritize water for essential services and identify priority users. Please refer to WHO guidance on climate resilient and sustainable healthcare facilities for more information. Thank you for completing this module. The key points to remember are: water is fundamental for providing safe, clean care and for respecting the dignity and rights of staff, patients, and caregivers. Water quantity and quality needs depend on the types of health services provided and number of patients and their caregivers. Treating water is vital, with many effective methods available. Managing water systems effectively can prevent concerns such as Legionella, which is increasingly problematic. Finally, developing climate-resilient water systems involves planning for backup supplies, storage, extra treatment, and infrastructure capable of withstanding floods, droughts, and other extreme weather events. Please review the reference section of this module to access links to all mentioned resources.